Exosome treatment for retinopathy. Retinopathy is one of the many possible medical disorders for which exosome treatment has promise. Diseases such as diabetes and hypertension are frequently the cause of retinal degeneration, which is referred to as retinopathy. Small vesicles called exosomes are essential for cell-to-cell communication and are being studied for possible therapeutic uses in regenerative medicine. Mesenchymal stem cell-derived exosomes are injected intravitreally as part of an exosome therapy for retinopathy. In the retina, exosomes reduce inflammation, encourage angiogenesis, and offer neuroprotection. To consider the effectiveness and safety of the therapy, clinical response is tracked using functional assessments, retinal imaging, and visual acuity.